All right, we'll go ahead and get started. Thank you all for being here for our COVID-19 media availability. On the docket today will be James English, our Operations Chief for COVID-19 Response, Kevin Dick, the District Health Officer, and Dr. Vanessa Slotz from Renown Health, who is also one of our reps for the Washoe County Health District. First thing I want to do, if it's all right, last week we kind of talked about some of the scheduling issues we were having with our boosters, and I just wanted to bring that back to light just because it has been addressed. So I'm going to share my screen here. So when you go to schedule a vaccine through us, if you're at the COVID-19washoe.com, it does take you then to the state's vaccine scheduler. So the process that takes place, it asks you if you have a severe immunocompromising condition. If you hit no, it now allows for people to get the Pfizer, Moderna, and Johnson & Johnson. It used to just allow the Pfizer. Just reading this, making sure that you fit the criteria, it then allows you to choose whichever option that fits best for you if you are getting that booster. It goes over some other questions for you that you have to fill out. And then after you get to this page, it goes to the scheduler, which if you put in the zip code for Washoe County, you will have multiple options, both at the drive-through at our livestock event center, as well as our community pods. And this also works for homebound as well. So that's just kind of the main update. That was a huge win for us, just because it's a lot easier to schedule those boosters instead of having people who needed Moderna or J&J have to fill out paperwork on site, which can take some time and delay the process. Now they can do it online. So they're all good to go there. That was the only update I have. I will now push it along to James English, our COVID-19 response operations chief. Jim, if you're ready, please go ahead.
Yes, I am. Thank you, Scott, and thank you everyone for joining the Health District today. The first thing I want to mention is there's a lot of misinformation regarding the Pfizer BioNTech vaccine and whether or not it's actually approved. And not only is it approved with an emergency use now from ages 5 and up, but it has a full biologics approval issued by the FDA and is fully approved for everyone 16 and older. The reviews are still taking place for the remaining review and applications when they submit, but I want to clear up that misinformation. We continue to hear at a lot of public meetings. That seems to be an issue and a concern, and people sometimes listen to that. But the FDA did issue a full approval back in August, and it is fully approved. It has gone through the same testing and review process that any other fully approved vaccine has. And it also has a commercial brand name now of Comirnaty. So you'll either hear that name or you'll hear the Pfizer BioNTech name for the vaccine, as they're used interchangeably still within the public, the media, and with doctors and providers. Secondly, I just learned in the last couple of minutes, the Washoe County Health District did receive their our first shipment of the Pfizer vaccine for the ages 5 to 11. It's important to note that because it is a different dosage and it has some different storage requirements. But we did receive our first shipment. We ordered 2,400 doses. We received it today. Furthermore, many of our pediatric providers throughout the community that had ordered this vaccine are also receiving it this week. And since we now have the vaccine in our hands, we will be offering it for the first time this Saturday from 9 to 11. This will be a first come, first serve a vaccination clinic. We know it takes much longer for children to be vaccinated. Sometimes you have to calm them down. There'll be some paperwork that'll need to be filled out. We are unsure of our total capacity, but we will be trying to vaccinate as many individuals as possible during that time frame. We do ask for your patience. You can't schedule ahead of time, and it will be a limited availability. Furthermore, as Scott just showed on the scheduling platform, there is no way right now to use that platform to schedule a 5 to 11-year-old age group. That will take an update from the state of Nevada and their TS and contractor. We're looking at probably at least 2 weeks before that's implemented. So at the Washoe County Health District, at our locations, we will be using a paper process as we did initially. It will take a little bit longer, but we will continue to provide the vaccines. And Going forward into next week, we'll be having another pediatric 5 to 11 clinic on Saturday, November 13th. And after that, we'll ensure that it's at all our community and our static pod here at the Washoe County Health District. Furthermore, we believe there's approximately 35 to 40,000 individuals in this age group, and it's really important that we work hard to get the correct information out on this vaccine and this age group and the need for them to be fully protected. I personally am looking forward to this and think it'll be great for our community as this group begins to be vaccinated. With that, Scott, I'll pass it back to you.
All right. Thank you very much, James. Appreciate that update. And just an update for media, we're just finalizing the press release that has all the information that Jim mentioned and some more. And we're going to look to distribute that as soon as possible. I'll now pass along to Kevin Dick, District Health Officer for Washoe County. Kevin, if you're ready, please go ahead.
Yes, thank you, Scott. Excuse me. And I want to thank James English and all the hardworking staff here that are working to make the vaccine available as soon as possible for the 5 to 11-year-olds. We're quite pleased that the CDC and the FDA have now authorized that vaccination. And last night, the Western States Scientific Review Work Group met, and they also unanimously approved and recommended that vaccine for 5 to 11-year-olds, and they informed our governor of that this morning. So I want to thank everybody that's been working so hard to make this available so quickly. Again, the doses are limited, and we're likely to have a bit longer of a process. We're going to have to begin this first come, first serve as we work on with the state on having the Salesforce platform available for scheduling for these doses. But we'll be working to provide it along with other community partners throughout Washoe County. I'd like to say that this vaccine news comes at a very good time because our COVID risk meter has ticked up to the red or the very high range this week. This is because we have an increase in hospitalizations that have been occurring, and we have our staffed hospital beds are 90% occupied in Washoe County. We've seen an increase in COVID-19 patients up to 133 on the state's dashboard today that either have confirmed or suspected COVID-19, and of those 31 are in the ICU. Our risk meter is also at very high because we continue to have a high number of COVID-19 case counts, and we've plateaued at a high level over the past couple of weeks. We had dropped down to 102 new cases as our 7-day moving average. But as of today, our moving average is at 122.6, and it's been bouncing around that range for a while. Our positivity rate is at 9.9%. That's been bouncing around between 9.5%, 10.5%. So we are continuing to see high positivity and high number of new cases occurring. So this is a great resource to have to be able to vaccinate the 5 to 11-year-old children in our community. I'd like to say with these high numbers that we're experiencing, it's still too soon to tell whether we're going to have an impact to those numbers from the gatherings that occurred over the Nevada Day holiday, Halloween, et cetera. We did test 122 people at our post at the Livestock Events Center on Monday, but we had over 200 people scheduled for testing today. Lastly, I wanted to point out that there's still a lot of people that are in the wait and see mode on getting the COVID-19 vaccine. And I'd like to remind them that we have had 192 million people in the US who are now fully vaccinated, and nearly 270,000 of our Washoe County residents are now fully vaccinated. Nationally, we've had 423 million doses of the vaccine administered, and here in Washoe County, we've had nearly 575 doses administered. So we know that the vaccine is safe and effective. There's a lot of rumors and misinformation that are going around about how dangerous the vaccine is. Those are very unfounded. And I think if people consider these numbers and the size of the population here just in Washoe County alone that's fully vaccinated, they should look around and realize that this is the safe and the right thing to do. So if you've been waiting, I would urge you to get vaccinated, and I would remind you that the holidays are coming up. And so now the opportunity to have younger children 5 to 11 vaccinated, as well as everybody else over the age of 12. This is a great opportunity to become fully vaccinated for that Christmas gathering so that everybody can be protected as you're getting together. With that, I'll turn it back over to you, Scott.
All right, thank you very much, Kevin. I'll now hand it over to Vanessa Slotz, MD, who's a pediatrician with Renown Health and also advisor to the Health District. Dr. Slotz, if you're ready, please go ahead.
Hi, good morning, everybody. So exciting to come forward with this news today that the ACIP and CDC and FDA have all voted unanimously that the 5 to 12-year vaccine can move forward. As a member of the American Academy of Pediatrics, also very excited. This is something that has been on our state AAP as well as the national AAP's agenda is to get this out, obviously in a safe fashion, but as soon as possible. I think so far everybody has mentioned a lot of really good points about this. So, with this vaccination, wholly supportive of everyone 5 years plus. If you are able to get this vaccine, please, please, please get vaccinated. A lot of people do show some concern with kids because they do feel like they are less likely to get sick. They're certainly less likely to get very sick. Their mortality rate is certainly less than our adult population. However, we have had millions of cases of children who have had COVID. We know based off of the data that for every 1 million child who is vaccinated in the 5 to 12-year range, it's expected to prevent 58,000 cases and 200 plus hospitalizations. There are 28 million kids in that 5 to 12-year range in the United States. And so if we are really working to get these children vaccinated, hopefully by the beginning of the year, we will have prevented 500,000 new infections. Also, as we have our rising immunity in our children, obviously that's going to help protect them, but even more so, it's going to help protect those vulnerable adults. So those that may not have been able to be vaccinated because of other health issues that are going on. And so, the expectation is if we can get our kids 5 to 12 immunized, we may see a drop by 8% of new COVID cases, which is amazing. Safety has been brought up already, and I just want to highlight the safety of this vaccination. So there were 4,600 kids that were put into this cohort. Some people are concerned with that number and may feel like it is a little low, but it's actually higher than what was necessary. And so, it's actually a really good cohort. As far as with the Pfizer vaccine in general, there are 106 million Americans that have had both doses of the Pfizer vaccine, 7 million of which are in the 12 to 18-year range. So with this particular vaccine that is coming out for the 5 to 12-year, we have a large amount of data around the side effects. Pfizer has reported that the side effects in the 5 to 12-year age group are less common, which is not uncommon when we look at vaccinations in general. This age group does really well with immunizations across the board. The most common thing you're going to see is pain and swelling at the injection site. That is going to be common with any vaccination. So keeping that in mind. Also, also your body is building an immune response. So for those who have already received their COVID vaccine, they may not have felt very well. They may have had some fever, some headaches, some chills. That may also happen in your children 5 to 12 years. Swollen lymph nodes in the neck and under the arms are also reported as being a possibility. And so I think it's just important to know that that is a normal response to any vaccination, including this COVID vaccination, as your body is mounting that immune response. So at this point in time, though, again, side effects are going to be less common in this age group. Some of the concerning side effects that people have brought forward or may have seen in older age groups, like the inflammation of the heart, that myocarditis, it has not been seen in this age group as of yet. It has been 4,600 people that were in this cohort, and this vaccination will continue to be monitored for that. But even in the cases of the myocarditis that we're seeing in the 12 plus age group, it is still very, very rare. And the risk of having that same myocarditis is actually higher if you get the actual COVID illness. And so it's still safer to get the vaccination, and your risk of myocarditis is less than if you get actual COVID infection. So at this point, I know we are all very, very excited to be having this vaccination available for the 5 to 12 year group. Again, very supportive of everyone 5 and above who is able to get this vaccine to do so, and to do so soon. It's been mentioned, obviously, that we're headed into that holiday season and people are really wanting to get together after being apart for so long. And we just want to make sure that that is done as safely as possible for everyone. If you have questions, all of the pediatricians have been following this very closely. So please reach out to your primary care pediatrician. They are vaccine events that are happening at the health department. Renown is also going to be hosting vaccine events on November 13th and 14th, which will be on the Renown website as well, that you have how to schedule for those visits. And so at this point, again, just very supportive of this and hope that everybody takes the opportunity to get this done soon. Thank you, Scott.
Okay, thank you very much, Dr. Slots, for that very informative presentation. We'll now open it up to questions for media. As always, please direct your question to either James English, Kevin Dick, or Dr. Slots. So I'll stop talking. Please go ahead and ask the questions.
Hi, Bob Conrad here. I don't know if you can hear me. I guess my question is related to masking. I'm seeing a lot of businesses out in the community not enforcing masking. Is there any effort to curtail that, or what are you seeing on your end?
Yeah, I'll take that one, Bob. I can hear you just fine. I think that it's disappointing that we are seeing businesses that are not following the governor's mandate for having people wear masks, and that we have individuals, even in businesses that are trying to comply with the governor's mandate, that are refusing to wear masks. We do know that masks are effective in reducing the transmission of COVID-19. We do know that we're very high with the Truckee Meadows risk meter for COVID-19 transmission. And so I would urge everybody to comply with the governor's mandate. But I think that we realize that it's impossible to be policing every business place, every public setting for those masking requirements. So we're looking for people to cooperate, to help protect one another, and to do the right thing.
No enforcement, though.
We're not engaged in any enforcement at the health district. I believe that the state OSHA program is taking action if there are complaints against employers.
Thank you.
This is Paul Nelson with 2 News. I think a lot of the parents that want to get their kids vaccinated, their biggest questions are, when can they do it and where can they get it done? Is there any advice for them of how they can go about this?
Well, we mentioned that we're doing the vaccination clinic here at the health district on Saturday morning. I believe that's 9 to 11. They can contact their pediatricians. They can contact the pharmacies to get scheduled. They can go to our website to see where different vaccine pods or community pods are happening, where they could get vaccinated as well. So those are what I would recommend to people. I do have a go back for Bob. I guess I shouldn't have said so broadly that we're not enforcing. We do have enforcement authority under SB 4 for the resort properties for compliance with the governor's mask mandate. So we do enforce that with our inspections there.
Thank you. I have a follow-up question, but I can wait.
Kevin, will Saturday be the first time you think the vaccine for kids, or some pediatricians doing it right now, or no, the Saturday likely the first?
I don't know what's going to be the first, Siobhan. We just received our shipment of the vaccine this morning.
Okay.
So I think everybody's just kind of just getting the vaccine or still waiting for it. But I think people are working to try to make it available as soon as possible.
Now, do you distribute it to pediatricians, or no? They may have ordered their own.
They can order their own, and many of them did. We can redistribute if there's a need for that. But we would urge the pediatricians to get signed up and to be ordering directly to receive the vaccine.
And then I'm sorry, I was on a little late. Did you say on Saturday how many doses you'll be giving out?
We're going to give out as many as we can, but realistically, we're shooting to get 300 doses administered.
And then for the doctor, I know you talked about how kids haven't really been the ones that have been super sick generally, but they'll really impact the spread in the community. Can you talk, you've been a pediatrician, have you seen, I mean, there have been cases of kids being really, really sick. What's that been like to be a doctor? Like, I know, because I've toured, the PICU at Renown, and there were kids on ventilators and stuff. What's that like when a kid is seriously sick from COVID? It's probably just it's bad enough for adults, but when it's a kid who can't breathe, what's that like when a kid is seriously sick with COVID?
It's devastating. We in our community, of course, we're seeing COVID in all age groups, including young children. We have lost a teen here from COVID-related complications. So we do have that in our community, and it's just, it's terrible. To have them in, even having to be admitted, to be in our floor, to be in our ICU, to need that ventilator support is, scary and devastating. As a pediatrician and as a parent, I, just hold my breath every day and hope that my child is safe and that all the children in our community are safe. Unfortunately, my child is just under this age group, and so I am anxiously awaiting for the studies to come forward for this next cohort of kids, so that I can also get my child protected. And at this point, now that we have a vaccination, I just, again, as a pediatrician, as a mother, I just urge everybody to really to get out there and get their children immunized and get them protected. I think there's, just then at least a little bit of a sigh of relief. While, of course, you can still get COVID after being vaccinated, but it is less common. And those illnesses after being vaccinated are typically less severe and less long. So that more risky level of illness is almost eliminated once you're fully vaccinated, which happens 2 weeks after that second dose. And, I think there's going to be, again, that little bit of sigh of relief that then you can get together more safely with friends and family. I have a lot of kids who aren't doing sports, who aren't doing activities, who may or may not be attending school in person, and just seeing the effects that that is having on our children is just devastating. We're seeing a rise in depression and anxiety. We're seeing a rise in obesity. We're seeing all kinds of mental health challenges around not being able to be part of our community and not being able to be at school, not being able to do those sports, those activities, get together safely with friends and family. And we need to get our kids back into these this kind of normalcy again. And this is the way that we're going to be able to do that safely. So I really, really hope that people will get their children immunized. And if there are questions, that they reach out to their pediatricians. We are ready to answer those questions and are excited to do so.
And with adults, there's been so much talk, like even if you do survive COVID or you've been at risk, like you have lingering health problems. Do you see that in kids as well who may have caught COVID? I know we had cases of the inflammatory syndrome. Is it really worry you as a pediatrician that there are kids who have had COVID that may have lingering health problems?
Absolutely. So, we are seeing that in some of our children. Of course, some do have very mild courses and recover fully in a short period of time, which is fantastic. But we definitely have kids all over the nation, including in our own community here, who have really suffered and are continuing to suffer months and months after having had COVID.
Have you had a patient like that? What's suffering mean? Like, can you explain what do you mean is the suffering? Like they have problems breathing, or what's the after effects of COVID that we're not talking about as much?
Yeah, so absolutely. So chest pain, difficulty breathing, having to be on oxygen long term. When prior to this, they were healthy and well. Mild things, but also from a just a day-to-day standpoint, there are kids that are 9 months out that still have lost taste and smell, which has really been hard to encourage a good appetite in these growing young children. And so, that is certainly much less of a suffering than having to be on home oxygen, but that's still a level of concern. And so we are seeing some long-term effects in the kids, even in our community and in my practice.
Do you think this couldn't have come soon enough, like the vaccine, as we go into, we just got past Halloween and people are gathering and you have every other illness that affects kids? Is this like, oh my goodness, like I wish we had this yesterday. This probably feels like, oh my gosh, we need this now as numbers rise. And, kids primarily haven't been super affected, but that doesn't mean they couldn't be as the virus changes too. Like, could kids really have more of an impact from COVID than we've seen previously without this vaccine?
Absolutely. I think many of us in our own homes, in the medical community, again with the American Academy of Pediatrics, we have been, very much geared up for this, really involved in this conversation, really pushing this forward. Obviously, this is it has a process and we need to follow it. And so it wasn't, we never wanted to go without walking through that process and making sure the cohort was large enough and included the right amount of kids and the right distributions and everything, so that we could see what that safety looked like. And the push was to get the review done quickly, which it has, and very, very thankful that the FDA and CDC and ACIP really got that moved very quickly, and got that data reviewed so that we could get it out as soon as possible. You're absolutely right. Could we have had it yesterday and we would have all been equally excited? Absolutely. And yet we also needed to follow the proper time frame, which we've done. And so at this point can feel very confident then about moving forward with this vaccination. I think it's also important, like you said, we're coming into the cold and flu season. So we aren't just talking about the COVID vaccine. We need to make sure our kids are also getting immunized against influenza, as well as our adults. if you were to get the flu and then get COVID on top of that, or vice versa, we could be really, really sick with that, having a dual infection like that. And you may not be able to come out the other side in a good place. And so, not only do we want to encourage everybody to get this COVID vaccination 5 and above who are eligible, but also that flu vaccine.
This is Paul Nelson with 2 News. I have just a follow-up question. When you look at the numbers of 10 to 19-year-olds, looks like there's 2 deaths in Washoe County and none under 10. So when people see those numbers, they might think, oh, it's not a big deal. I don't need to vaccinate my kids. How do you convince them that they should?
Absolutely, and that's a great question, and that's not just in Washoe County. Again, our mortality rate for children is significantly lower than our adult population. However, we also know that kids are vectors, and so for our community in general, we need everybody to be healthy in order to be able to stop the spread of this illness. Again, as we increase those that are immunized, we raise the immunity of our community through that herd immunity. And that, again, not only protects our children, but also protects vulnerable adults. There are people that are not eligible for these vaccinations because of certain health issues. And we just need to make sure that we're protecting our whole population. The other piece of this is, again, the projections is that there are 28 million children in that 5 to 11 year range. And for every 1 million vaccinated, we could prevent 58,000 cases of COVID and over 200 hospitalizations. And as that builds, then that number, again, our hope is by March, if we can get everybody immunized, and even if it's a slow process, which we know that there's going to be some delays, that we could be preventing 500,000 infections, which in the end of this is going to be slowing transmission of this virus. It may not stop it, but it's certainly going to slow transmission. And so, this is about protecting your kids, but it's also about protecting, our community. It's about protecting our parents, our grandparents, our great-grandparents. So it is, as much for your child as much as it is for everybody else in our community as well.
This is Paul Nelson again. I have a question for Kevin about testing. I know that there's a few events in town where they're requiring either vaccination or a negative COVID test. Have you seen, I know you mentioned that there was a spike in people getting tested after Halloween, but are you also seeing more people coming in to get just that negative test so they can go to these events? And then what's the turnaround time look like?
Yeah, so Paul, we don't track like whether people are getting tested for an event or not. And we really here want to function as a safety net for people to get tested who otherwise don't have access to testing or who are identified as close contacts of cases to be tested. So we may have some of those coming here, but I would encourage them to seek testing from other providers if they're doing it for recreational purposes.
And then do you know what the turnaround time generally is right now?
For our testing, we're getting results within 24 hours.
A question for Kevin. This is Bob Conrad again. Can you speak a bit about the sort of the peaks and valleys we're seeing with the new cases and where we're at in terms of being in high or very high range of transmission? Thank you.
Yeah, sure, Bob. What we saw was a significant surge that took us up to 300 or so new cases per day for a 7-day average. And then we saw a really good decline that brought us down to that 102 that I mentioned for the 7-day moving average. And since then, we've seen an increase again, and we're bumping along in that 120 or so 7-day average range. And we really would like to see that number come down so that we can effectively do disease investigation to be able to identify close contacts, to isolate people that have the disease, to quarantine people that have been exposed, to help to control the spread. So That's why between that and the hospitalization numbers and the positivity rate from our testing, those are all the indicators that are driving that risk meter to the very high level. And that's also consistent with CDC's criteria, where we're in high transmission level, which is the trigger under the governor's mandate for the mask requirement here. So what we've seen is that we've come down from the peak, but we're at much higher levels than we were earlier in the year, June, July timeframe, when we were down around 20 new cases per day versus 120. So 6 times as high as where we were earlier at the beginning of the summer.
Thank you. And I know that some agencies are requiring COVID vaccinations. I understand that Washoe County is not. Can you explain? I don't know if you're a part of why that is, but I'm curious to hear your thoughts on that. That's
so the OSHA is expected to be putting their rule in the Federal Register here in the next few days. That is going to have the requirements for either vaccinations or testing for employers of 100 or more employees. And so I think a lot of people are waiting to have that come out. And so I can't speak for Washoe County, but I think that's the reality that many employers are in right now, is waiting to see what's in that rule and understanding what they need to do to comply with it.
Does the health district have a mandate for employees to be vaccinated?
We have, fortunately, Bob, an extremely high vaccination rate here at the health district. Almost 97% of our staff are vaccinated, and we are requiring all new employees to be vaccinated.
And at the health board meeting last week, your new board member indicated he was not vaccinated. It seems to me that goes against the recommendations of the health board and the health district. Is that fair to characterize?
Well, we're recommending for people to be vaccinated, and we're also recommending that people consult with their physician if they have concerns or if they have other conditions. So, I can't speak for that particular member. He did indicate that he supports vaccinations and intends to be vaccinated.
Thank you.
Hi, this is Laura with Reynoldia. Probably parents are concerned about how safe is this vaccine for their kids. Is it the same formula that adults are receiving? And if they're gonna get sick like us, or like me, I got sick after the vaccine. Yeah.
If Dr. Slotz is on, I think that might be a good question for her. I can tell you that it's the same Pfizer vaccine, but it's just a third of the dose that the adults get. But I'll turn it over to the doctor on this one.
That's absolutely right. So same formulation, but they are getting a third of the dose. It is a very safe vaccine. It's been very effective. Again, what we have seen is 106 million Americans have gotten 2 doses of the Pfizer vaccine, while there are obviously more that are fully vaccinated, but there's 106 million that have received this specific Pfizer vaccine, 7 million of which are the 12 to 18-year-olds. And so we do have a lot of great safety data about this vaccination. There were 4,600 kids that were in the cohort that Pfizer used, which is more than what was recommended, which is fantastic. The most common side effect was pain and swelling at the injection site, again, which is going to be the same with any vaccination that you get or any injection in general. It is breaking the skin, so it is going to be painful. Side effects in this age group were shown to be less common than in the 12 years plus, and that is not necessarily uncommon with vaccinations either. The children, 5+ do really well with vaccinations in general. Of course, there's always that potential for fever, fatigue, headache, chills, those kind of flu-like symptoms. Swollen lymph nodes have not been uncommon with this vaccination. This is typical of potentially any vaccine that people get. You are building an immunity towards this. I say you're building your army, and that's just can make you feel a little bit under the weather. And so that is certainly not uncommon with the COVID-19 vaccine, as well as any other vaccination that that anybody gets, whether a 5-year-old or a 65-year-old. And so side effects, again, have been shown to be less common in this age group. Even though there were 4,600 kids that were in this cohort, they will be continuing to monitor safety. One of the things that did come forward in the 12 to 18-year age group was that inflammation around the heart, that myocarditis. It was only in a few patients of that 7 million that have been immunized with the Pfizer vaccine. And so it is very rare. It's actually higher risk of getting that myocarditis or that inflammation of the heart after having a COVID infection. And so you're actually at less risk of getting myocarditis with the COVID vaccine than actually getting the COVID infection. And so, yes, may you have pain and swelling at the site? Absolutely. May you not feel very great afterwards? Absolutely. Is it going to last for more than a couple of days? No.
I thank you very much for that answer.
Absolutely.
Dr. Slots, will patients still be getting 2 doses for the 5 to 11-year-old age group?
Yes, so it's the same recommendation of 2 doses 3 weeks apart. It is just a third of the dose at each of those.
Will you have a longer watch period? Like I know with some people who have reactions, will there be a different process for watching kids after the vaccine than versus adults, or is that the same?
It's the same. So, if there's going to be a reaction, it's typically going to be within those 15 minutes. And so that same watch period is still what's recommended for children.
And what could happen in those 15 minutes? What's a reaction you're looking for?
So, mainly what we're looking for is a severe allergic reaction. And for the most part, if you've not ever had a reaction to a vaccination in the past, we do not expect you to have a reaction to this vaccination. And so that is really what we're watching for in that 15 minutes. Again, the typical side effects typically are going to happen within that first 24 hours. And so resting, hydrating, Tylenol or ibuprofen, if that's appropriate or needed, is totally fine to utilize. But that first 15 minutes is really looking for a severe allergic reaction.
So if you haven't had a reaction to the flu vaccine as a kid or some of these others, chances are there won't be for this. But if you have had a reaction to those things, maybe do it in your pediatrician's office or something.
Well, everywhere is going to be equipped for this. That's what that 15 minutes is for. And so at a pediatrician's office, at the health department, at the renowned clinics that we'll be hosting this event at as well, there will be medical staff on site. There will be the ability to deal with an allergic reaction if it does come forward. And if you've had an allergic reaction to a vaccination in the past, I would encourage you to talk to your provider just so that you know what your particular risk might be moving forward with this vaccine. But yes, most likely, if you've never had an allergic reaction to an immunization in the past, this one will not be any different.
Is it the same kind of staff who's given the other vaccines that'll do it for this age group? I would just think in some cases, a child is probably harder to wrangle in a seat than an adult in the drive-through type clinic setting.
I'll let somebody from the health department.
I think that one may be for me. Thanks, Dr. Slots and Siobhan. We actually have been doing some just-in-time training for everybody that's involved with administering the vaccines on how to hold children while you're vaccinating them, and the approaches and techniques for that. But you're
So
right.
will the parents hold the kid, or will the person who's given the shot hold the kid?
I was not actually the one doing the training.
Okay.
I will not be giving the shot or holding the kid.
You won't, but somebody. But is it kind of same thing? You drive through and you do it when they're buckled in the car seat or something, or you restrain them?
We can also take them out of the vehicle and administer the shot in the little office building there.
Did you buy lollipops?
I don't know. I think that's his question for Scott.
Jim, you want to take that one?
We are looking at what we can do. We have some stickers and some other items we'll be providing. We're also looking at bringing in therapy dogs and making some of our future vaccine pods for this age group more of a kind of community event. So it's a positive experience.
So is anyone being vaccinated, like from your staff or anything, starting today, or everything's going to start Saturday?
Jim,
I guess sure. So we are still working on all the logistics. We have to update our consent forms for the vaccine for this age group. We have to get a new standing order signed by our physician. We are in the process of doing all that. This was just approved yesterday. We also had to ensure we had the vaccine, but our intent is to provide it on Saturday. If it gets provided anytime sooner, it would only probably be for logistical purposes to make sure our processes are set up. As mentioned earlier, our drive-through pod is not the ideal location. So this Saturday's clinic, we're actually going to be doing it in our clinic offices to assist with that in this age group. But we're going to continue to work through the logistics and figure out the best way and the simplest way to provide this to this age group. We know they're going to be skittish. We know that most people that show up to our drive-through pod, they're here because they want the vaccination. And with this age group, their parents are the ones that probably really want them to have this vaccination. But for all the time I've spent out at our location, whether it's testing or vaccinations, I think it will be a much simpler process for us to vaccinate the 5 to 11-year-old group than it is for us to try to get a nasal swab through a test when they're sick and ill. That is a much more, it takes a lot longer to get a proper swab of those individuals, and they really don't like it. So our staff is very compassionate, they're well trained, and I think we'll be really successful in our rollout.
Any other questions?
And I'll just add one more thing, Scott. Just no one's asked, but my children are also in this age group, and just want to let everyone know they will be being vaccinated. They want to be vaccinated. They want to stay in school. They want to protect their grandparents. So they are very excited. They've been following this, and most likely will be vaccinated this weekend. So I just wanted to let everyone know that this was an assignment I was provided, and if I didn't believe that what we're doing here at the health district is safe and the best thing for our community, I probably wouldn't be in this position. I think we're doing the best job possible, and I've done a tremendous amount of research on my own, trying to educate myself on everything related to this virus, the testing and the vaccines. I believe they're fully safe, and we'll be looking forward to this weekend starting the process to ensure that my family unit's completely safe.
Through this last year or two, have you just been worried doing what you do when you're still out there that your kids who are in this age group could have gotten sick? You know, are you just thankful that they didn't? Was that stressful for you as a parent?
Yes, that's been very stressful. I have a multi-generational family. I have a father that's well into their 80s with lung problems. So it has been a very trying last 18 months. Sorry, my internet's really bad today. Furthermore, I remember being asked back in December when the first wave of vaccine showed up, those original about 3,000 doses. And as I mentioned then, I would see the light at the tunnel when the entire population is capable of receiving the vaccinations. I know a lot of anxious parents that are below age 5 that won't be as lucky as I'll be after this week. I do feel that we need to do the best we can to protect our younger citizens. I've already had kids out of school this year, multiple weeks. They're looking forward to staying in the classroom, and I think that's the best for our community, our economy, and to finally move forward.
I just wanted to thank Dr. Slotz for joining us today. She's a practicing pediatrician, so she took time out of her schedule. I hope that Dr. Slotz, you have time for some lunch today. Obviously, this is a really exciting day, and this is I think the longest media brief that we've done in quite a while. So thank you very much.
Thank you. I am thrilled. I have been having this conversation with parents for, basically since the vaccine started coming forward. And so it's just, when the 12 to 18 came forward, we were just so excited to be able to offer that to that age group. Now that the 5 to 11 has come forward again, I've had so many conversations with parents every single day about when this was coming, how to go about vaccinating. Even in the last just since this morning, I have answered probably 15 emails and phone calls about where can I get this? Can I get it today? And so our community is excited about this, and I am so thrilled to be part of this media event, part of the health department, part of the community here. I am sadly in that group again where my son is 4, so he is out of this. And so again, we just continue in our family because I do see sick kids every day. I am testing for COVID every day, and as soon as I get home, it's change clothes, wash hands, wash hair, take a shower. Sometimes, depending on what I've seen in the office that day, that I don't pass this to my son, and he's in daycare, and so that risk is there as well. And so I am anxiously awaiting for him to be able to be in this next group of vaccinators coming forward. So, I'm thrilled. Thank you so much, and I will figure out how to make time for lunch anytime.
Do you have any estimates, any of you, on how many in this age group do you think will get it? Isn't it about 40% for the older group of kids? Do you have any estimate on what you're expecting to see with this younger group, or even in your practice? Do you see, like, is it 50% of parents maybe are for sure they're going to get it? What do you think we could expect to see?
Well, Siobhan, I think time will tell for us on that. And I think that there are a lot of people that are very eager to have their children vaccinated. There are other people that are going to be a little bit more hesitant. So I would just encourage people to take advantage of this opportunity. And if you've got a child in that 5 to 11-year-old age range, to get them vaccinated as soon as you're able to.
Okay, any further questions? All right, thank you all for being here. Thanks to Dr. Slotz and Kevin and James. We'll be recording this, or it is recorded, so we'll be putting it on the website soon. And like I said, the press release that has a lot of the information on when this is going to be available to the community is coming out shortly. We're just getting it finalized, but we'll send it out in an email blast on social media and on COVID19watcher.com. Thanks. Have a great day.